I just want to give you a very simple advice, whether you're a new grad or experienced dentist, which is stop reassuring your patients. The difference between a happy, content dentist and a miserable, unhappy, stressed out, empty book dentist is how often they reassure their patients. And I'll give you some examples in this video. But first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my dental practice, Lakeside Dental Spa in Hervey Bay in Queensland. I took it from 1 chair to 10 chairs, from 3 staff members to 40 staff members over the course of 14 years, and you can check my details below for credibility. So let's talk about 2 scenarios. Scenario number 1 is new patient exams. Scenario number 2 is existing patients that you're performing treatment. And I'll tell you the difference between a happy dentist and a very unhappy or a miserable dentist. A happy dentist is a dentist who have the skills to raise concerns and make sure the patients are not reassured too much. So for example, we have been taught at university that we diagnose, we recommend, and we reassure. Reassure means, let's say you have a new patient exam, patient has a gum disease. A gum disease is when the bacteria is attacking their gums and their bone, and if you don't treat this disease, they will lose their teeth. So what we were being taught is to, tell the patient you got gum disease, you need some gum treatments. The patient say, oh, is it serious, doctor? Will I lose my teeth? And then what happens? You have been taught to reassure the patient and say, yeah, no, don't worry. When we book you in for the deep clean or for the gum treatment, we will be able to maintain your teeth, and there's a high chance you'll keep your teeth. Thank you, doctor. The problem when you reassure patients too much, they might not go ahead and do any treatments. Most patients are really laid back about their teeth or their oral health. And if you reassure them too often and too much, the chance of them going out and booking their appointments is very, very low. Don't get me wrong. There are maybe 1% of patients that, they require more reassurance, and they are the minority. Those are the patients who are always panicking about their teeth, really obsessed about their health, and those are the ones you want to reassure. But the 95% of patients are too laid back. So instead, I want to make sure you are raising concerns and make sure you don't reassure them too much. So they need to be aware that if they don't fix their gum disease, they will lose their teeth without creating panic. Call that squeeze and release. So, with your keep your teeth, there's a high chance that if you go ahead with the gum treatment, and it's an ongoing maintenance, we want to see you every 3 months initially, then every 6 months. There is home care you have to abide to. But I'll be honest, if you don't do any of that, yeah, there's a high chance you will lose your teeth. So you have to be very honest with them, and you don't want to reassure them. You want to raise their concerns without creating panic. It's very important. Second scenario where dentists can get miserable and unhappy as well. Let's say you place a filling on a patient, and the patient will ask at the end of the appointment, so everything will be okay after that? And again, you've been told to reassure them, yeah, you might be a little bit sensitive, but you'll be fine. You do an extraction, and patient asks, oh, will I be in pain? No, if you take the pain relief, you'll be okay. If you're in pain, just let me know. Again, you're reassuring your patients too much, and what happens? Patient goes home for a few days, their teeth are sensitive after a filling, or they get a dry socket, they are in pain. And guess what? They're not happy. They will call the practice, he will give you a 1-star Google review, and they say, you did something wrong because you told me I'll be fine. So instead, I want you to be very honest with your patient. I want to make sure you don't reassure them too much. If you place a filling, you can tell them, hey, you might be sensitive for a week or 2. We have basically placed a chemical filling very close to your nerve. The nerve might react to it, might take a week or 2 until it settles. You might be very sensitive to cold, sensitive to hot. But if your body doesn't feel right, and it doesn't feel right after a few days, give me a call because I need to check it. You do an extraction, you tell them, you might be in pain probably today and tomorrow. I'll write some pain relief to you, but it's a surgery, it's a minor surgery. And if on day 3 you are having pain that's much worse than when you came to me for, and the pain is throbbing to the side of your head, you could be getting something called a dry socket, where your body is rejecting your blood clot that's formed. And I need to see you so I can fix this for you and maintain it for you. So if the patient go home and they don't have any sensitivity after the filling, or they don't develop dry socket, they don't have any pain, they will think very highly of you, and they will be very appreciative and thankful. But if they go home and they get this pain, they expecting it because you told them you might get this pain. And then they won't be very angry at you, and hopefully you'll be a lot happier as well. So take home message, do not stop reassuring your patients, and I guarantee you will be a much happier dentist, and you will have fuller books, and you will do your patients a great service because they will be more happier at home as well if they are expecting something that will happen, and they will book appointments to fix their problems. Thank you so much for listening to me. If you find this helpful, make sure you like and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel and turn notifications on, and you'll be notified when more videos are released.